Good evening. Welcome to the talk show on cancer awareness, an initiative by Integrated Health and Wellbeing Council supported by Roche. I'm Dr. Asavari Sawant, Public Health Specialist for IHW Council. And as we commemorate the World Cancer Day today, here we discuss the not much talked about cancer care gap. With this year's theme, WHO emphasizes to strengthen health systems to prevent and detect cancers early, to provide prompt treatment referrals, and also to enhance access to palliative care and to reduce the gap in access to equality of cancer services to all. In the previous part of this two-part talk show, Dr. Jyoti Wadhwa and Ms. Riddhi Lakra discussed on the topic closing the cancer care gap, focusing on early detection and prevention. In this session today, we will be deliberating on the topic raising awareness and minimizing the equity gap in cancer care. To discuss this topic in detail, we have with us the very eminent Dr. Priya Tiwari, who is Senior Consultant of Medical Oncology and Unit Head at Artemis Hospital, Gurugram. Ma'am, we welcome you to the show.
Thanks a lot, Dr. Sabri. It's a very challenging topic that you are going to discuss. And yes, I'm glad that you are discussing this topic because this needs to be, discussed on a platform like this. So thanks for the invitation.
Thank you so much, ma'am. Cancer in itself is very challenging. So let us now discuss the much needed discussion that is there, closing the gap in cancer care. Half of the world's population lacks access to the full range of essential health services when it comes to cancer. Many of us are denied basic care, despite the fact that we live in a time of awe-inspiring advances in cancer prevention, diagnosis, and treatment. This is what we call the equity gap that is costing lives. So, ma'am, can you please talk about what measures can be taken to raise awareness on cancer, especially for the underprivileged population?
See, the thing is, yes, thank you. So the thing is, the underprivileged population have a very different priorities than the more privileged section of the society, isn't it? They're never going to come to the hospital to understand that what is cancer and what are the health related measures that one should take and what exactly is cancer. I mean, if you ask people, even if you ask the most literate part of the world, how many of them actually know what exactly is cancer? I think very few will know what exactly is cancer. So if we talk specifically for about the underprivileged population, they're not going to come to the hospital. Okay, so we have to go to the community. The people who are motivated, and that is where also the role of volunteers, the role of NGOs, and various other health related organizations are going to come into the play to go to the community and make people aware about what is cancer, and yes, what are the preventive measures, what are the screening methods, and yes, some lifestyle modifications that's are needed. So that is one thing. So yes, more and more community based gatherings are something that should be done. Second thing is, a part of also needs to be done is to bring in our basic education, like the integrating these matters, health related matters, cancer related matters in our basic education. Okay, because everything starts from there. If you educate people in the school itself about what are the major health issues, and yes, cancer is also one of the problems, then maybe over the period of time we'll also learn, even the underprivileged population will also automatically take in a behavior, avoid alcohol, avoid smoking, because those are the sections where we see a lot of, like in India, canny and all those methods. So if you're going to educate people in the school itself, integrating these matters in the school itself, that in long term is actually going to have a bigger impact in all the sections, including the underprivileged parts. So something, a big measure, a big step, but yes, something which has a long-term repercussions and a sustained impact.
Definitely, ma'am. We need so many such measures to make a lasting, sustained impact, because India has been trying to overcome this hurdle of cancer since years now, and we have made significant progress. But at the same time, so many such sustainable measures are required so that the future of cancer care is secured for Indians especially.
Yes.
Let us now move on to discussing another issue, which is people who seek cancer care are hit with barriers at every turn. I'm sure you would agree
Yes.
that income, education, geographical location, and discrimination based on ethnicity, race, gender, sexual orientation, age, and many such factors are just a few of the factors that can negatively affect cancer care. Many people get discouraged when the cancer treatments are on the expensive side. So what physical and emotional barriers people face while going for cancer screening that you have observed in your practice, and what should be your advice for someone who is suspecting cancer?
So the barrier people have, so people don't know about screening. That is the biggest barrier. So one has to educate themselves about cancer. One has to educate themselves about the screening methods also. So people should know what are the screening methods available, what are the cancers, isn't it? So the first step is educate yourself. We have screening methods which have shown documented decrease in mortality for breast cancer, cervical cancer, also colon cancer, and now we also have a screening methods available for lung cancer. So yes, educate yourself, find out all these tests which are available. That is the first thing. Now, second thing is the emotional barrier people. Suppose I'm diagnosed with cancer, right? So everybody's fearful of that C word. So what people think that if I go for a screening method, like it said that above 45 years of age, if the female, they should go for the breast cancer screening. They don't do it because suppose if I find cancer? So the fear is the most important emotional barrier. That's the fear in the mind of the C word. What is important is to know is if you have a screen detected cancer, that means it is you don't have symptoms, right? So that means it is in a very early stage, or when the disease is very teeny tiny, it's like a very limited disease. So lesser disease, lesser will be the treatment, and best will be the outcomes. People have to understand this, that yes, there might be fear because of the C word, but a timely detection leads to prevention of deaths. So fear is the most
Golden
important
words,
factor
ma'am.
that we see.
Golden words right there. That
Yes.
timely detection would lead to prevention of deaths. And if so, catching early is the
Yes.
best way to cure and
Yes.
possibly get rid of cancer completely from your body.
Yes.
So, my and ma'am's advice would be here to not fear the word cancer. If you are suspecting that you might have this tumor or signs of cancer, please get checked as early as possible without delay. That would be the best advice. Let us now discuss another thing, which is that the cancer care gap not just affects one person, but everyone in some way or the other. We might feel like equity gap doesn't impact us personally, but it likely does affect someone we know. While it's more pronounced in low and middle income countries, well resourced countries also show dramatic disparities. It's almost guaranteed that this disparity gap in cancer care affects you or people in your community. So, ma'am, what gaps have you observed that yet prevail in the cancer care system in India, and at what levels do these prevail, and what, according to you, can be done about it? I agree. This is a three-part question and could take another 2 hours for us just discussing different things. But if
The
what
biggest,
would be your top things that you would want to convey?
see, you ask any on call this, the biggest gap is financial, isn't it? India is still a country where people are still paying out of the pocket to buy the medicine, to buy the health care, isn't it? We don't have government sponsored scheme. We don't have drugs at subsidized rate. And yes, the insurance part is also lacking for a lot of patients. So the financial gap is something that is huge. So you have a corporate setup, you have a government setup, and yes, sometimes you also have a charitable setup. So somebody needs to have a certain amount of financial support to go into a corporate setup, though they're trying to do their best. Government setup, people go, but yes, they are overburdened with too many numbers. So you will see that the treatment is delayed there, long waiting lists are there. And yes, sometimes you also see charitable setups, but the numbers are few, which can actually act as a bridge between these two kinds of setup. So the biggest challenge is the financial one. We also see because the social fabric of country is now changing. So social support is also something which is now becoming different. A lot of patients have their family members working outside the country. So this is also one of the challenges that we are realizing, that if the role of primary caregiver, who is going to play the role of a primary caregiver, when the patients had joint families in older times, so there were just too many people to help the patient. Sometimes we see, because now there are just more and more nuclear families coming in, so the social fabric which is changing, and we also see a changing support system. So a lot of patients also have a challenge in arranging for a proper support system. So yes, and like you rightly said, the geographical disparity is huge. Though the cancer care is actually spreading across all countries in the tier 2 cities also, but suppose if you have to go to a small town or a small village, you won't find the same level of expertise, care, hospital in a small village. So yes, the financial disparities, the geographical disparities, the changing social fabric, all these things are impacting the cancer care.
So, ma'am, you discussed many factors that that prevail in cancer care system, and those are the gaps. So one was that came out loudly was that the financial disparity that people have, and we agree that cancer care and cancer treatment can be very costing to the lives of people, and can be very expensive for everybody almost. We would dive deep into this topic in the next question that I ask you. Another gap that got highlighted was that in rural areas where there is less connectivity, less expertise, and less number of doctors present, there we see many people suffering from these disparities. So connectivity, the financial disparity were two biggest reasons that we need to really look into. So let us now discuss what you rightly mentioned. Ma'am, through these years, there have been cancer researches going on. And cancer types and cancer treatments are also evolving. Why do we still see cancer treatment and cancer care being expensive after so many years of research and so many years of advancements? What would be your reason for that? I'm sorry for just diving deep into this particular one, but this has been always in my mind. So I
See,
just want.
most of the research is not Indian, isn't it? That's the main reason, because most of the drugs are not being brought in by the Indian pharmaceutical companies. So, whenever we talk about a cancer, see, I tell you, the main problem here is because people are not aware, even the doctors are not aware, most of the patients in India are actually diagnosed in a very late stage. Now, like I previously said, when you have less disease, the treatment is also less. Okay, when you have an advanced disease, the treatment goes on and on and on. So for somebody who had a stage 1 disease, suppose if you require surgery or chemotherapy, the treatment will be like for 3 months or 6 months. But somebody who has metastatic disease, we also have a lot of metastatic advancements. So initially we used to say patients are going to like live for 6 months, but now they are living for 2 years, 3 years. So they need to be treated for that long. So the treatment, if you have higher burden of disease, the treatment goes on and on and on. Okay, so more is the and unfortunately in India, more patients are diagnosed at an advanced stage disease. Now, when you have advanced stage disease, you require that as long as the patient is doing well, patient is tolerating treatment, we need to treat that patient to maintain the quality of life, isn't it? So the treatment becomes long. So the first barrier that we face is because of the extent of disease that the patients usually have. In India, most of the patients are actually diagnosed at an advanced stage. So that is one of the challenge that we see. Now, second thing is because of the accessibility of the care, the drugs are just the part of it. The whole system has to treat the patient. So it's the cost of the whole system that the patient is being, what the patient has to pay for the whole system. So what we have is what we need are more better subsidized hospitals which can actually help patients. So you just have few government hospitals which are treating cancers. So you need more such hospitals. So that kind of system that you need, which can actually treat a patient at a very, very, very low rate or at economical prices. Because most of Indians, if you see the income disparity is huge in India. Majority of patients are not able to afford the care that is being offered in a corporate hospital. The third thing is about the drugs also. A lot of new advancements in coming, the research is coming, but most of them it's not Indian. Now, for many drugs, fortunately, India, unlike many other countries, have a good system of generics, good quality generics, which have actually tried to bridge in the gap for a lot of costly medicines. And we have availability of many such medicines for all groups of patients in the country. But lot of new research, lot of new drugs are actually quite expensive. Even the richest might not be able to afford. They are expensive to that extent because all that research is not Indian, and all that treatment is brought in India. But yes, because this is not in India, the drugs are not manufactured in India, the research is not Indian, the cost is not as per the Indian norms or the guidelines.
Definitely, ma'am. I completely agree with all the points that you have nicely explained us, the entire scenario. And promoting research, cancer research, and more advanced cancer research in India would be the greatest solution to, bridging this gap of equity in care, also providing more accessible and more affordable quality of medicines in India. So let us now move on to the other topics that we have with us. Please, can you share how can the government support the doctors and care providers in providing equitable care for cancer prevention? Again, this is a very vast thing, but the good news is that we can close this gap if you and me try, our very best. The reality today is that who you are and where you live could mean the difference between life and death, which isn't fair, but we can change this. So, ma'am, how can the government support the doctors? What steps, in your opinion, are still required for bridging this gap?
So, government is doing a lot, but of course, there's always a scope to do best, especially for a country like India, which is so vast. So, the first step is identifying the problem area and addressing one of them. So, like we just now discussed, that the geographical distribution is also a very important factor. So, suppose if a doctor is not able to go to a village, so maybe now, there are a lot of NGOs which are taking a lead, which the government can also do is that if a doctor cannot go, then you can do a video conferencing kind of arrangements so that the patient can interact with the doctor, isn't it? So suppose if you have a primary healthcare worker who can arrange these kind of video conferencing calls, so that is where you can where the hospitals can integrate with the government, can integrate between various hospitals and the doctors itself, so that you are able to reach, make your arms wide and the span can spread across all the countries in the smallest of villages. So we have so much of technologies coming in. So with the help of the internet, I think the government can reach all sections in the all parts of the country with the expert care. So that is something that the government can ensure, that at least if the doctors are not able to go, if the patients are not able to come to the city, then yes, maybe some kind of arrangements can be done so that they're at least able to interact, and then the treatment can be initiated. So the first step is to have this kind of interaction, then decide the plan of investigations, followed by yes, plan of therapy. So a lot of centers are actually already doing this, but we need to do it a wider scale. So that is first step. Now the second step is we need to be faster in opening more and more expert cancer care centers. The government centers, the good thing about government setup is that they can treat patients who just can't afford anything. That's the beauty of the government setups. But what we have seen, that they are much overburdened, and the long list of waiting for the radiation therapies, and cancer care can't wait. So the treatment needs to be started as early as possible, because if the treatment is delayed, the general condition becomes worse, patients are not able to tolerate, and yes, the cancer also spreads. So a timely treatment is very important for the cancer. So what we need to understand is that we need to have more cancer care centers, maybe at the existing model or a better model, the government oriented, the government setups where we can actually treat the patient. So we need to increase these centers. So that is what the government can take initiative. So I think these two are the very important ones. Besides giving the subsidized cost of the medicines that are coming and which are very costly. So the equitable distribution, the price control, and yes, the subsidized rates of the drugs would be a big help for a lot of patients.
You have highlighted amazing points, ma'am, and definitely with the digital health mission that India is holding, and with the coming of G20 presidency this year,
Yes.
I am sure the government with its digital health integration systems would soon have this very thing right there, making it accessible for patients to get detected early and get the treatment and care delivered to them in a much faster, much efficient manner. So, so my question to all of you watching this video is that, is inequity the same as inequality? What do you think? In healthcare, inequality refers to the uneven distribution of resources. By contrast, inequity means unjust, avoidable differences in care and outcomes. The difference may be subtle, but closing the cancer care gap isn't really about simply providing everyone with equal resources. Care providers should know that one size doesn't fit all, and every challenge demands a different solution. Equity, which we are talking about in this session, is about giving everyone what they need to offer them a chance to enjoy similar outcomes. So, ma'am, let us now talk about what, according to you, does an equitable world would look like in context to cancer care. So over to you.
Equitable, equal, okay. See, when I work in my OPD, and first thing is when a patient walks in, I don't have to think what I would prefer, what I would want is that I don't have to think about the finances of the patient, you know. So we need to have a healthcare system which is treating everybody irrespective of the financial strata of the person. Okay, so it's like that. I need that this is the treatment plan and I go for it. Isn't it? Now what is happening in the current world is I have to think, oh, can this patient afford this? Should I need to make any adjustment? Should I need to refer the patient somewhere else? All those things I need to think. But that is in the best of the worlds, that should not be there, isn't it? That's the treatment that should matter, isn't it? That is the first thing. Second thing is the other aspect is, like we already discussed, the geographical equity or the equitable distribution that we are discussing about, isn't it? A patient who is being treated as being offered as good as care in a village is like, it has to be as good as somebody sitting in Mumbai or Delhi NCR in a top-notch hospital, isn't it? So the place should not matter. Third thing is where the people also have to take an initiative is that we need to have more and more support group for the patients, isn't it? Most of the time cancer patients feel left out. They feel left out from the society, they feel left out at their workplace, they feel left out in their families. So we have to educate ourselves as a society, as a whole, that we need to understand that we need to cultivate an emotional intelligence, that how these patients should be dealt with, isn't it? Most of the time we are just giving them all kinds of advices. Like just to give you a common example, we have been told, अच्छा चलो आप तो स्मोक करते हो इसलिए आपको कैंसर हो गया. See, we are not trying to give guilt to anybody. Okay, we need to understand cancer can happen to everybody, though there are certain risk factors. So what we say to these people are also very important. So somebody who has all the affordability in the world, but it's not being given the right word, will again be suffering from the wrath of cancer. Okay, so we as a society needs to cultivate certain, educate ourselves so that we are able to form a proper support group for our loved ones who have had cancers. So these things are very important. Yes.
Thank you so much for answering that very crucial question very nicely, ma'am. You highlighted some of the main factors that still prevail in our society. As you rightly mentioned, that cancer can happen to anybody, regardless of the risk factors that the person has. Even the most healthiest individual can have cancer. At the same time, a person involving in different risk factors that cause cancer can also have it. So the point is not to provide the guilt that is already existing, but make a society wherein cancer treatment is facilitated with ease and with comfort and with the best services possible. So we are trying, you and me, our very best to make people as much aware as possible, to make them as comfortable as possible, to reach out for help, to speak up if they are having any issues, to not fear the word cancer, and to get treatment as early as possible, early detection and early treatment. We will achieve health equity when every person has the opportunity to reach his or her full health potential without barriers or limitations by social position or other socially or commercially determined circumstances. This initiative IHW Council aspires for raising awareness and minimizing the equity gap in cancer care. Ma'am, on this day of World Cancer Awareness, World Cancer Day, what would be your closing remarks, your end notes for all the listeners that are watching us?
Okay, so very important messages that people should have is people think that the cancer is a disease which is different from all other cancers. The risk factors are all different, but it is not like that. The risk factors of blood pressure, diabetes, stroke, heart attack are all same. They're essentially a disease of some kind of metabolic alterations in your body. So the risk factors of all these disorders are same, and that is why all these disorders are seen more with increasing age. So don't blame yourself if you develop them, because yes, we understand that sometimes with increasing age, all these problems can be seen. So avoid self-blame. That is very important. Understand the risk factors very well. Have a healthy lifestyle so that yes, many cancers are actually preventable. And even if you develop cancer, if you have a healthy lifestyle, the treatment side effects are very less in people who live an active lifestyle. So yes, work on your lifestyle, and yes, avoid the known risk factors. So that will be all.
Thank you so much, ma'am, for so amazingly answering all our questions today and making this session so informative for all the viewers that are watching. My last question would be to you, what other topics in cancer care do you feel still require, awareness? What should be highlighted more as per your opinions? And what should you and me work towards in the space of cancer care?
See, there are a lot of things that one can do. People don't know that uh, people don't know anything about cancer, basically. So we need to educate the masses what exactly is the cancer. Even doctors don't know. If you go to sometimes if the person is going to a doctor with a range of symptoms, a doctor will think range of possibilities, but general physicians, they don't think the cancer as one of the differentials. So what is important is, yes, the public has to educate themselves about the cancer. That is the first step. The second steps are the independent cancers. There are, more than 50 kinds of cancers which can happen inside a body. And if you ask people, they won't know name of in just 4 or 5. So deep education about cancer is very important. Understand about the risk factors of cancer. That is again very important. The other step is, suppose if you have developed cancer, then if you don't have money, please try to find out, you have to educate about yourself that what are the channels which can actually help you. There are NGOs which are helping, there are source of crowdfundings, and there are government schemes which are helping. So people need to know that yes, how the cancer therapies or the cancer disease related finances are actually developing or evolving. So that's something that we need to educate people also. And yes, the cancer screening is very important topic. People need to understand that there are cancer screening tests available, and yes, the cervical cancer or the HPV vaccination.
Thank you so much, ma'am. Just a thought. Similarly, the way we have been creating awareness on sexual health and sexual health diseases by integrating, reproductive system chapter into the school education,
Yes.
at the right age. Do you feel that integrating basics of cancer knowledge and basic awareness into the risk factors that could lead to cancer into the early years, into secondary school knowledge or biology, human biology subjects into the higher schools education would be important and would help in creating better awareness, teaching young adults about what can cause risk factors so that in their life that they can avoid it. What would be your thoughts on this one?
So there are two things which are very important in this regard. Yes, bringing this into school education will definitely help, because anything which is started young gets more and more integrated inside our mind also. So yes, bringing this into school education would be a good step. But the second step which I feel is that there has to be some kind of volunteering services that should be integrated in our education system, where these kids, the school kids, they are being given some kind of volunteering services to the healthcare services. We have now hospice services. The concept of hospice is coming for the terminal ill patients. So maybe these students as a volunteers, they should be posted and allowed to see these kind of situations that will also orient themselves, that what the old age, what the disease or what it looks like, and that will also orient themselves better towards the health or the cancer related awareness. So I feel that yes, we need to educate the volunteering services, integrate volunteering services to universal school education.
Thank you so much, ma'am. That was a brilliant idea, and I'm sure the concerned authorities would come across this and get benefited. So, with that, we wrap up this very interesting session with Dr. Priya Tiwari, Senior Consultant, Medical Oncology and Unit Head, Artemis Hospital, Gurugram. Thank you so much, ma'am, for taking out your time from your busy schedule and for creating awareness on this very necessary topic of minimizing equity gap in cancer care, the much needed, less discussed topic. With that, we wish you all good World Cancer Day. Please get checked regularly if you are suspecting yourself of any problems related to cancer. And please take care. Have a nice evening. Thank you so much.
Thank you.